This changes everything. That's the reaction many Canadian doctors had on Tuesday when Health Canada quietly dropped a bombshell. Ozempic. Yes, the same weekly injection millions already use for blood sugar control just became the first drug in the country officially cleared to slow kidney disease and slash the risk of dying from heart-related causes in adults with type 2 diabetes. But here's where it gets controversial. Some experts argued the approval is so broad it could open the door to off-label prescribing far beyond the patients who actually need it. Are we witnessing a medical breakthrough or the start of a runaway prescription trend? Keep reading, then tell us what you think in the comments. What exactly did Health Canada approve? In plain language, the regulator said, if you have type 2 diabetes and your kidneys are already showing early signs of trouble, Ozempic isn't just optional. It's now recommended to protect your kidneys and your heart. That's a first for any once-weekly diabetes medicine in Canada. Until now, doctors used Ozempic mainly to lower A1C, and as a pleasant side effect, watch the pounds melt off. Starting this week, physicians can also point to hard data showing the drug delays the decline in eGFR, the key blood test that tracks kidney function, postpones dialysis, and cuts the combined risk of dying from cardiovascular or kidney causes. The science behind the headlines. The FLIR trial. Picture more than 3,500 volunteers in 28 countries, Canada included, who already had both type 2 diabetes and chronic kidney disease, CKD. Half received a weekly 1 milligram shot of semaglutide, the active ingredient in Ozempic. The other half got a placebo. The trial began in 2019, but an independent safety board hit the brakes early because the benefit was so obvious. 331 serious kidney or heart events in the Ozempic group versus 410 in the placebo group. Translation: a 24% relative risk reduction. For every 100 high-risk patients treated for roughly 3 years, 8 major complications were prevented. That's the kind of number that makes nephrologists cheer and insurers sweat. And this is the part most people miss. The trial wasn't powered to look at weight loss or A1C alone. It zeroed in on hard clinical endpoints: dialysis, transplant, death, meaning the approval rests on outcomes patients actually feel, not just lab values. A ripple effect across the pond. While Canada moved first, the U.S. Food and Drug Administration, FDA, hasn't sat idle. Just days ago, the FDA granted a separate green light to Wegovy, a higher-dose cousin of Ozempic, for adults with non-cirrhotic MASH, an aggressive fatty liver condition, provided they also have moderate to advanced liver scarring. The ESSENCE trial delivered the evidence there. Taken together, semaglutide is quietly becoming a multi-organ protector: pancreas, heart, kidneys, liver, and waistline. Sticker shock? Maybe not anymore. Let's talk money. A month of Ozempic or Wegovy can easily top $900 if you're paying out of pocket. Enter GoodRx, the discount app giant. On the very day Health Canada announced its decision, GoodRx revealed a partnership with NovoNordisk that drops the self-pay price to $499 per month for eligible U.S. patients. Last year, nearly 17 million Americans clicked on GoodRx for GLP-1 savings, up 22% from 2023. Critics call it a clever marketing ploy. Fans call it life-changing access. Where do you stand? Wall Street shrugs, then smiles. Investors barely flinched at first. NovoNordisk shares edged up just 1.1% to $54.34 by Tuesday's close. But seasoned biotech watchers know that first-in-class approvals in large markets often translate into steady, compounding revenue. The real question: will Eli Lilly's competing drugs catch up? Or has Novo just widened its moat? Your turn. Breakthrough or bandwagon? We've laid out the facts. A 24% drop in kidney and heart risk. A first-of-its-kind Canadian label. and a price cut that could put the drug within reach of millions. Yet some doctors worry the headline will tempt low-risk patients to demand a prescription they don't need. Others argue that if a weekly shot can delay dialysis by even a few years, the healthcare system saves far more than the drug costs. So we're asking you, yes, you, reading this right now, is Ozempic's new kidney and heart shield a genuine game changer? Or are we over-medicalizing a problem that diet and exercise could still fix? Drop your unfiltered opinion below. The most thoughtful responses may be featured in our next follow-up piece.